Welcome back to Think America with Terry Gilberg.
All right, let's leave Chelsea Clinton and Kim Jong-un on the back burner and talk about something a little bit more domestic, I guess, here in the United States and with teenagers. There is a new rise in teen interest in plastic surgery. And from what I can discern, in teens choosing actually in the end to go under the knife. So I've invited a plastic surgeon out of Dallas to come and share some of her thoughts on this. She's Farah Khan, Dr. Farah Khan. She is with the Khan Plastic Surgery Institute out of Dallas, and she joins us now. Dr. Khan, hello.
Hi, Terry. How are you?
Just fine, and thanks for being on Think America. All right. Teens are always interested in who's the cute girl and who's the cute boy and all of that. We already know that. But I've not known that teen interest in plastic surgery is on the rise until I started reading more about it. I mean, you know, I get it if somebody has really got a cleft palate, somebody really needs something medically, but how much of this is cosmetic? And is it a good thing that teens are this interested in going under the knife for cosmetic purposes first? Let's talk about that first.
Sure. You know, I think in recent years, especially as we've become more aware of bullying, I think teenagers have gotten a little bit more interested in cosmetic surgery. Like you said, obviously, there are always the reconstructive procedures for which, you know, they've always been candidates. But I think, you know, if a child has very large or prominent ears, really it's typically because someone will say something about it that they're going to seek surgical correction. Or if they don't like the shape of their nose, they're going to come in for a rhinoplasty evaluation. I think nowadays, just with the rise of social media, you know, we're always posting selfies. We're on Instagram, we're on Twitter, we're on Facebook. I think teenagers, just like the rest of us, are very aware of how they look. And so if they feel like cosmetic surgery can be a quick fix, they are going to be interested.
You know, we don't have a stigma about braces and orthodontic work. You got crooked teeth. Oh, let's fix you. But we do have a stigma about plastic surgery with teens. Why is that?
Well, I think, you know, surgery, at the end of the day, there are always risks, right? So, I mean, plastic surgery is still real surgery. It isn't just fake, fluffy type of surgery. So we need to make sure that, you know, if we do operate on teenagers, then they need to have the emotional maturity. They need to also have the physical maturity. So,
what do you mean by that? They need to be their body needs to be older in look than their age.
Well, for example, like you know, when we, you know, in layman's terms, when we pin back the ears, right, for a child who has really prominent ears, you need to make sure that you do it typically after the age of 5, because that's when the ear has actually attained essentially its adult size. So you never want to interfere with some body part when it's still in the growth stages, or even like a nose job, right? You want to wait until it's really stopped growing, which is probably about the age of 15 or 16, before you actually intervene and do something.
I see. All right. But on the crooked teeth idea, you know, it seems like teens are quick to get braces. Parents go, oh, God, we got to fix your teeth. But if they naturally have crooked teeth, what's wrong with that? You know, and yet if they naturally have big ears, we say, oh, we got to fix it. There seems to be a disconnect in both of those.
Well, and I think, you know, getting braces, really the risks of getting braces are not as great as undergoing surgery under general anesthesia, right? Well, and so I think teenagers really do need to.
It can be as expensive, though. I know. I got my own kid orthodontic work. And it was you know, visits and visits and visits and cash and cash and cash and write the check. All right. I'm interested, as a plastic surgeon, I'm interested in your relationship with parents, particularly parents, because plastic surgery is expensive. Let's face it.
Sure.
And a lot of it is not picked up, especially the cosmetic, is not picked up by insurance. So what is your relationship to parents who seemingly have a lot of money? They want to just do whatever for the kid, take them to the fancy shops at the mall and so forth, and the kid kind of is showered with gifts. What do you say to parents when it's kind of the relationship that they have with their teens is the tail's wagging the dog? The kid wants to get the nose job. The kid wants this, and the parents go, okay, honey, okay, little Sally, okay, little Jimmy, you can have whatever you want. Let's go see Dr. Khan. And you know dang well that you got to have a serious talk with those parents because they're not going to push back on their kid, so you have to push back on them. How do you handle that?
Exactly. Well, I think the first thing you need to do is make sure that the teenager, the child, is the one who actually wants it. Because we've had parents come in who are, just very critical of their child's appearance or whatever. And when you kind of separate the child from the parent, the child will admit that he or she really doesn't care. He doesn't necessarily want to have a nose job, but it's really the parent. So I think the first thing is you want to make sure that the teenager really is the one who wants it. I think the second thing is you need to make sure that they have realistic goals, because at the end of the day, plastic surgery is not going to make your life, amazingly wonderful, right? It'll correct whatever it is that you're looking to correct. A lot of girls, I think, at the age of 15 or 16, if they have asymmetry of their breasts, so if, let's say, one breast is like an A cup and the other one is a D cup, of course, we can definitely make that better. But again, I think they need to realize that at the end of the day, it isn't going to make them the most popular kid in school. It isn't going to, all of a sudden make them get straight A's. So somehow you need to make sure that they have realistic goals and expectations. And then, I think what goes hand in hand with that is also making sure that they do have the emotional maturity, that they do have the physical maturity, and that they understand it really is surgery. It isn't just putting on braces. It isn't just getting a haircut. You have the same risks that someone who's 21 will have when they undergo general anesthesia. And you need to also understand they will have a recovery period, and there will be a period of 6 to 8 weeks during which time they will be swollen, they may be bruised.
Well, sure, I was going to ask you about that, because if you're 15 or 16 and you want to look like Miss America overnight, you have that downtime, and then everybody in school knows, well, you got plastic surgery. You weren't really pretty organically or genetically, so if you're pretty now, it's because, well, your parents are rich and got you plastic surgery. Kids are funny that way. It's almost like, well, now it doesn't count. You're still the ugly girl, but you had money, so you're not really pretty.
Sure. Well, and again, it's just, I think you really need to figure out what are their reasons, right? If someone really has a lot of emotional distress or is depressed, obviously they're going to be better served by visiting a therapist, and they need to spend more money, obviously, on mental health, right? Because plastic surgery, again, I'm not going to change your social status in school. I'm not going to be able to, add a ton of confidence or whatever. Hopefully, I think it's all, and this typically comes out. I mean, when I see my patients, I'll spend easily 30 minutes to an hour with them. And as you start talking to them, you understand what are really their motivations for undergoing plastic surgery. And, with kids especially, you want to ask them outright, is there someone else who, has made fun of, let's say, your nose? Is that why you're doing it? Why is it? What is motivating you to come into my office?
Right, and so that cycles back to this question. Do you get in your practice more parents that you have to push back on, or more kids that you have to push back on? Because you mentioned earlier, Dr. Khan, that the kid is mox nix about it. Maybe they want it, maybe they don't. It's the mom and dad that are pushing it. So in your practice, because it's a specialist practice and it requires out-of-pocket money for the cosmetic, do you get those parents mostly that you have to push back on, or is it the kid in your practice?
In my practice, and it might just be because we're in a relatively affluent area of Dallas, we often see parents who are putting almost undue pressure on the children to look a certain way. And a lot of times parents will kind of phrase it like, well, I wish I had this opportunity when I was 18. And I wish I could have gotten a breast augmentation then, but I couldn't. So, now I see my daughter, she's struggling. She can't, wear a strapless gown for prom, whatever it is. We'd love for her to, get breast implants. And that's when it's hard, because if the patient doesn't want it, I'm not going to touch that. There's no reason for me to do any sort of plastic surgery. I mean, that's just from an ethical, moral point of view, it's just wrong.
Well, sure. I mean, one could even argue it's borderline child abuse. I mean, if a girl is 15, she's still underage, parents still, and then they push this on her, and she doesn't want it. Couldn't that be somewhat child abusive?
I mean, I guess, these are parents who, in their mind, they think they're doing their children a service, right?
Yeah. Mm-hmm.
It's just like...
Yeah, it's the mom who said, I never had a size D cup when I was 16, and I want my child to have it.
Exactly.
Yeah, right.
Yeah.
Dr. Khan, we need to, that's my music, so we need to wrap up. But you're a delight to have on the program. Will you come back and visit with us another time?
Definitely.
Okay, Dr. Farah Khan out there in Dallas of the Khan Plastic Surgery. Really good interview. Thanks so much. We'll be right back. You're listening to Think America.